My name's Lauren Meffen, speech pathologist and certified lymphedema therapist. Let's talk through a case study. 76-year-old patient with prior base of tongue tumor was treated with definitive radiation as well as chemotherapy, HPV-positive P16. The patient is now 2 years post-treatment of head and neck cancer. The patient is a survivor of head and neck cancer, comes for their 6-month follow-up to myself as the speech pathologist because I tell my patients, you are my friend and patient for life. This patient has a 6-month follow-up and reports new onset symptoms of what they describe as burning with salt, burning with salsa, and otherwise known as nothing tastes good or dysgeusia. Dysgeusia is a side effect following radiation therapy, and it can last for the remainder of life. It's one of the side effects that every patient experiences slightly differently. So, what do I do as the therapist? My checklist for my patients who report new symptoms. First, I look. I have the patient open their mouth. I place a tongue depressor in. I look around in their cheeks, the back of their tongue, the tip of their tongue. Second, I check their range of motion, I check their strength, and I listen to what the patient is telling me. Third, I take my finger. I place my finger along their tongue, over the back of their tongue, along their palate, the roof of their mouth, in their cheeks. And then next, I ensure that the patient has communicated these concerns with their physician. In this case, the patient did. They spoke with their radiation oncologist as well as their ear, nose, and throat physician. They are very compliant with their follow-ups. They have repeat scans scheduled. And now they want to know, how can we, as speech pathologists, help? Because what is happening is they are continuing to lose weight. So I develop a plan. I say, okay, first, you are doing amazing because I am their cheerleader. Second, let's take a look at your swallowing because you're reporting some new onset difficulty swallowing. So I complete a fiber endoscopic swallowing exam in this appointment. Now I develop a new plan of care for this patient. So let's continue to follow the series and find out, what does that plan of care look like in a patient who is medically cleared with new onset symptoms? However, when you start to dig a little deeper, those symptoms have always been there. The patient just feels like they're worse, and now it's impacting years later their weight loss and their quality of life. So we do quality of life assessments. Quality of life assessments help us guide where our patients' goals are and set new plans. Follow along.